Nancy Cordes is on Capitol Hill. So Nancy, take us through some of the key changes in this bill.
Well, the bill adds about $45 billion in opioid funding. That's a big change from the first bill. And in order to pay for that and more stability for the individual insurance markets, the bill ends up keeping a bunch of Obamacare's taxes on the wealthy. That is something that is making some conservatives pretty uncomfortable. And at the same time, this new version does not address the key concern that half a dozen or more moderate Republicans had about the cuts to Medicaid in the bill. Most of them have Republican governors back home who are giving them an earful, saying that their states cannot afford cuts to Medicaid of this size, that it's going to leave a very vulnerable population out in the cold when it comes to health care coverage. And so, curiously, Mitch McConnell, when he was revising the original bill, really left those Medicaid cuts in place. And so moderate Republicans had not much that was good to say about this new version. They say they're reading it, they're going to go back and talk to state officials and take a look. As you saw, Susan Collins is already a firm no, and we haven't seen any moderate Republicans who appear to be more inclined to vote yes than they were before.
I think you just answered this next question, but Nancy, several Republican senators met with Majority Leader McConnell Thursday afternoon to discuss the second version of the bill. Can you tell us more about that?
Sure. You know, the case that he has been making is that this bill puts billions of dollars into a stability fund for the individual market, that it keeps a lot of Obamacare's subsidies or tax credits for low-income Americans in order to help them buy insurance. So anybody who might otherwise have gotten covered by Medicaid, he's arguing to these moderates, could potentially now get covered on the individual market, and they'd have help to do that. But what some of these moderates are hearing from their Republican governors is that that's all well and good, but that the cuts and the caps on Medicaid happen so quickly that it really doesn't give their states enough time to adjust. And so they're really watching very closely to see what the Congressional Budget Office has to say. The CBO is going to be releasing its analysis of this revised bill probably on Monday of next week, early next week, we're told. And moderate Republicans are going to be watching to see if the numbers look any better than they did with the first bill, when you'll recall that the CBO projected that there would be some 22 million more Americans uninsured in the next 10 years under this GOP plan, primarily because of those cuts to Medicaid.
So, Nancy, does it appear that McConnell could actually lose some votes for the current bill?
You know, that's a great question, and we'll never really know because there were so many Republicans who were unwilling to go on the record with where they stood on the first bill. So we never had a very hard count of how many Republicans would have, when pressed, supported the first version. So we don't have something to compare it to. What I can tell you is that Ted Cruz, who managed to work some of his proposals into this new version, is happier. And he says if his proposals stay in the bill, he's now a yes. He was a no before. But one of his closest colleagues, Mike Lee of Utah, who worked with him on some of those proposals, says that looking at this new version, he's not really sure that it's any better than the original version. He has big problems with some of those Obamacare taxes being left in the bill. Rand Paul, who was a hard and fast no, says this new version keeps even more of Obamacare than the original bill. And so you can start to see what a narrow path Mitch McConnell has here, and some senators have begun to say that it appears that he is already aware of how difficult it will be for him to get the 50 votes. And so if he's going to fail, he's going to fail with a more conservative bill, which this is viewed to be, than a more moderate bill.
You mentioned Senator Rand Paul. After that meeting, he said he doesn't think that they'll move forward. Let's take a listen to some of what he had to say.
This time it looks like there are enough no's that the bill can't go forward. I mean, we've had announcement of 3 or maybe 4 people that are no's. What that seems to me to indicate is that maybe we should try a different way.
I mean, is there another way forward, a different way here?
Well, he certainly hopes to. He's got a number of proposals that involve basically repealing all of Obamacare or big chunks of Obamacare and then going back and trying to craft an alternative. You've got a lot of Republicans, however, who say that that is an unworkable proposal. First, because it'll throw the insurance markets into chaos. They'll have no idea what's coming next. And then they say, look how much trouble we're having coming up with a solution the first time. Imagine how much harder it will be once there is no Obamacare and we're basically starting from scratch. So he hasn't gotten a ton of support for that idea. But I will say that you are starting to see Republicans casting about for any way out of this situation. You had Lindsey Graham and Bill Cassidy suddenly out of the blue reveal their own proposal today, which they said was an alternative to the McConnell plan, even before Mitch McConnell had unveiled that plan to Republican senators, because they could kind of see the writing on the wall, and they realized that there's still a lot of opposition to the Republican leader's plan, and they just wanted to get theirs out there. So you're going to have a lot of Republicans sort of churning over the next few days, trying to figure out what is Plan C if they can't get this version passed. All
right, we know you'll continue to watch it all. Nancy Cordes on Capitol Hill for us. Nancy, thanks.
You're welcome.